Hi, I'm Brian McCrindle. I'm one of the co-chairs of this 11th International Kawasaki Disease Symposium.
And I'm Ann Rowley, the other co-chair.
So after a busy Wednesday, we're off to a running start today on Thursday with an opening session that was sponsored by the Cardiac Children's Foundation in Taiwan, all about the use of standardized coronary artery measurements for defining and classifying coronary artery involvement. And this has become an important issue in that with the use of these normalized measurements, it gives us the potential to get better information about prognosis and the impact of therapies in the long term for patients with important coronary artery involvement. But clearly one of the messages throughout the morning has been that we need to look beyond just measuring the lumen to actually measuring some of the structure of the coronary arteries, the function of the coronary arteries, look more in depth at the myocardium in terms of fibrosis and evidence for perfusion defects. And there are some new imaging modalities that will be discussed at this meeting, including novel uses of CT, intravascular ultrasound, optical coherence tomography, and MRI. In addition, we have an extensive session this morning about outcomes of the natural history and prognosis for patients who've had Kawasaki disease with regards to their coronary involvement. A number of the discussions are going to be around the fate of the patient who is at highest risk, which are those patients with giant coronary aneurysms. And we have results that will be presented from two very large multinational registries, together with a number of long-term studies coming from single institutions both in North America and Taiwan. And then we'll have our collaboration session.
Right, so our lunch symposium today will be on discovery through multi-institutional collaboration. So at this meeting, we want to not only discuss the results of previous multi-center collaborations, which are very important in Kawasaki disease, in order to get the number of patients that we need to really determine the effect of interventions and so forth. But we also want to focus in this lunch symposium primarily on how these different groups formed their collaborations, how they set it up, what problems they encountered, and what lessons they could teach all of us about forming additional collaborations in the future, which will be so important to learning what we need to know about children with Kawasaki disease and their outcomes.
And as Jane Newberger pointed out yesterday when she gave the Ogawa, or I think it was Monday, yesterday she gave the Ogawa Lecture about challenges in performing clinical trials, which are essential means for us to getting the best available evidence that we are dealing with a disease that is rare and that the outcomes are rare. And so these collaborations are going to be very important in answering questions not only about acute management and even etiology, but also particularly long-term management. So after lunch, we have the Richard Rowe Memorial Lecture, which will be given by Etsuko Suda regarding risk stratification and outcome in patients with coronary artery lesions, and then some further long-term outcome types of studies looking at exercise response, involvement of other vascular beds, such as using measurements of carotid intimate media thickness, and looking at some of the long-term impacts of therapies that may have been used during the acute treatment, such as steroids. We'll also be talking about some long-term management issues, particularly around need and results of anticoagulation and different methods for revascularization. And then we have a very interesting study that shows how statin may influence the subacute chronic inflammatory process that is sometimes seen in the coronary arteries using PET scanning.
We'll then proceed to a session on lifestyle and psychosocial issues, which are very important in Kawasaki disease children and their families. This disease can result in severe heart disease, and determining what the outcomes will be for an individual child can be difficult, and this can result in a lot of issues for the family. We'll be having a discussion on transition to adult care, because these children may grow up and have lifelong heart disease, and we need to be able to effectively transition them to adult care. Adrian Kovacs will be giving that lecture from the University of Toronto. We'll also be having a Parents Association Symposium later in the day, and there'll be a panel discussion, but in particular there'll be a new memorial lecture at this Kawasaki Symposium called the Alex McCormick Memorial Lecture, and that will be entitled Facing and Coping with the Unknown, which is a very important topic for these families.
Yes, and at the same time that the parents will be having their symposium, we'll be having our second poster session, and then of course our dinner tonight.
Mm-hmm. And we'll celebrate Dr.
Kawasaki's
Kawasaki's birthday.
birthday.
Mm-hmm.